In this session, I'm going to explain about the ICD-10-CM updates 2021-2022. So in general, there are few coding updates. So the appropriate codes which are used in ICD-10-CM are what? So the codes which are used in ICD-10-CM are A00.0 through T88.9. So there are n number of codes in between these code range. And also, what are the other codes? We'll use Z codes. So this is the range. And also U codes also we are using U00 to U85. So why these codes are used? These codes are used to identify the diagnosis, symptom, or a condition, or a problem, or any complaint to a patient who is visiting the hospital, encountering the hospital, and visiting the hospital with a condition, with a diagnosis. So in order to identify what is the disease or symptom, so we will use these codes, right? So in the medical report, whatever the provider is documenting the diagnosis, so the medical coder will give a appropriate ICD-10-CM code from this code range. Next, we'll see the coding update of laterality. In the medical report, a patient is having hand pain. So, if suppose the patient provider is not documenting the laterality, nothing but which side the hand pain is affected, whether it is left hand pain or right hand pain. If it is not documented, so in those cases, the medical record documentation should be from other clinician. So any other clinician should update it, whether it is right hand or left hand, other than the patient provider. Suppose if there is a conflict in the medical report regarding the affected side where the pain is, hand pain is, whether right hand pain or left hand pain, so in those cases the coder needs to query the provider for clarification where the pain is. Codes for unspecified site should be very rarely used, very rarely. When we have to use that, when the medical report is insufficient, and also it is very impossible to obtain the clarification which side is affected. So in those cases, unspecified code should be used. So this is the update regarding the laterality. Next, we will see the remaining coding updates. We'll see the next coding updates. So I said, right, clinicians other than the patient's provider, when the laterality is not documented, so other than the patient provider, clinicians can also document. So who are these clinicians? Clinicians are nothing but the healthcare professionals. They are also the healthcare professionals, but they are permitted based on the internal hospital policies. So based on the internal policies only, they are permitted as the healthcare professionals. So what can they can be document in the medical report? So here is the list. So they can document all these kind of things like laterality, as I said, right, coma scale, pressure ulcer stage, BMI. So all these can be documented other than the patient provider, nothing but the clinician. So they can also document these kind of information in the medical report, and these codes are reported as a secondary diagnosis. See here, you can see the last point, BMI, coma scale. So body mass index, when we will give this code along with the obesity code, coma scale, when patient is having loss of consciousness, we will document, we will code this coma scale score. So all this kind of can be documented by the clinicians other than the patient's provider. So apart from this, the providers will also document the overweight, obesity, stroke, or any conditions related to alcohol related disorders. So these are documented by the patient provider, not the clinicians. Please do remember this point. Overweight, obesity, like these conditions will be there, right? So these kind of conditions are documented by the patient provider, whereas the BMI, pressure ulcer, all this kind of information is provided by the clinicians. We'll see the next few points. So there should be a joint effort between the provider and the coder. Why? Because the provider needs to document a accurate medical report and the coder needs to assign the appropriate code assignment, right? So there should be a joint effort between the provider and the coder. And also the entire record, the medical report should be determined. Why? What is the reason for the encounter? The entire record should be reviewed appropriately by the coder. And also Z codes. Z codes are used in general to explain the reason for encounter for healthcare services, including the transfers between healthcare facility from one facility to other facility, why a patient is being transferred, like that. If anything is there encountering, so sometimes Z codes are used. And also the Z code gives a relevant information for what purpose the patient is encountering to the facility or hospital. So these are the few general coding updates. In the next session, we'll see one by one chapter updates.